Many people assume that revision surgery is simply about fixing something that did not go as planned the first time. But in reality, revision surgery is more complex, more delicate, and more unpredictable than the primary surgery. Hi, I'm Dr. Timothy Shim, Director of Plastic, Reconstructive and Aesthetic Surgery at Eagle Aesthetics and Surgery. And today, I will explain why revision surgery is not just a repeat of the original procedure and that it actually requires a very different level of planning and consideration. Want to hear more from our doctors at Eagle Aesthetics and Surgery? Subscribe to our channel for more insights on topics ranging from aesthetic medicine to oculoplastic and plastic surgery. So, what is revision surgery? Revision surgery refers to any procedure performed to correct, improve, or to address issues following a previous surgery. This could be because the original result did not meet certain expectations, healing did not occur as planned, anatomy changed over time, complications developed. Importantly, revision surgery is not always about a mistake. Sometimes the body simply responds differently to what was to be expected, even after a well-performed operation. So, why is revision surgery more complex? The biggest difference between primary surgery and revision surgery is the condition of the tissues. In cases of revision surgery, surgeons are no longer working with untouched, unaltered anatomy. Instead, we are dealing with scar tissue, altered blood supply to the tissues, changes that have been made to the anatomy, reduced tissue flexibility. Scar tissue behaves very differently from normal tissues as it is stiffer, it is less predictable, and does not heal in the same way. This makes surgical dissection more challenging and limits how much adjustment can safely be done. In some cases, the structures that are normally relied upon for support or shaping have already been modified or removed. That means the surgeon has fewer options and must be more strategic in planning the revision. Patients often come in with a very specific concern. One bump, one asymmetry, one area that feels off. However, revision surgery is rarely about correcting a single isolated issue. Changing one part of the anatomy often affects surrounding areas, especially in procedures involving the face, the nose, breasts, or the body contour. What looks like a small problem on the surface may actually be connected to a deeper structural issue beneath. Addressing only the visible concern without considering the underlying anatomy can lead to further imbalance or dissatisfaction. This is why revision surgery often requires a more comprehensive approach rather than just a quick adjustment or a quick fix. One of the most important aspects of revision surgery is expectation management. Unlike the primary surgery, where we often aim for significant transformation, revision surgery is usually about improvement rather than perfection. There are limits to how much can be changed once the tissues have already been altered in the primary surgery. It's also important to understand that revision surgery may take longer to perform, involve a longer recovery phase, require staged procedures, or carry higher risk compared to the first time. A good consultation focuses on what is realistically achievable rather than promising an ideal outcome. Another key consideration in revision surgery is timing. The body needs time to heal fully before any revision is attempted. Swelling, scar maturation, and tissue settling can take many months. Operating too early can interfere with natural healing and increase the risk of further complications. In many cases, the best decision is to simply wait, even when the patient feels frustrated or anxious about the results. Revision surgery requires not just technical skill, but experience in managing complexity. A surgeon needs to understand how tissues behave after the primary surgery, how to work safely around the scar tissue, when to operate, and more importantly, when not to. Equally important is an honest communication between the surgeon and the patient. A responsible surgeon will explain both the possibilities and the limitations of revision surgery clearly, rather than offering an unrealistic reassurance. While revision surgery can sound daunting, it is important to remember that many patients do achieve meaningful improvement with careful planning and appropriate timing, and also with realistic expectations. With a skilled surgeon, realistic expectations, and proper post-operative care, revision surgery can be performed safely and most of the time successfully. If you are considering revision surgery, the first step is a thorough assessment to understand your anatomy, your previous procedure, and what options are generally available and appropriate for you.